Okay, what are after birth contractions? Let me tell you. Hey, my name is Kara. I'm a mother baby nurse and a mom of 3. You might think, okay, well, my baby is out. Why would I still have contractions? Well, you do also need to deliver the placenta. So usually you're still going to have those contractions because your placenta needs to be delivered as well. The uterus is the organ that had your baby and your placenta in it. And so after the baby comes out, it's still just this big muscular organ that needs to shrink back down to a pretty small size compared to how big it was when your baby was in there. Now, inside your uterus, you're going to have about a dinner plate size wound where that placenta came away from your uterine wall. Whether you had a vaginal delivery or a C-section, you're still going to have some amount of bleeding and some blood clots from inside your uterus, and those do need to come out. That bleeding does need to stop, and it can be normal to have bleeding for a few weeks after delivery. Now, your body and your brain is so smart, and it says, yeah, we want to get that bleeding to stop, and we want to get our uterus back down to our, pre-baby size. So what it does is it contracts, and it's gonna sort of feel like contractions, the same thing. It's that tightening of that muscular uterine organ. Now, the contractions won't be as intense, obviously, as when it's contracting during labor and it's trying to get your baby out. And for some people, the afterbirth contractions aren't really that painful. For some people, they are really painful. And that's why it's so important. As your nurses and your healthcare providers, we need to take your pain seriously. I will say things that are really helpful is stay on top of your medications, to keep your bladder nice and empty. So go pee on a regular basis. If your bladder's super full, it can keep your uterus from contracting and shrinking back down. When you breastfeed or anything that releases oxytocin is a hormone that tells your uterus to contract, and it's working to try and get your uterus back down. So that's why if you are breastfeeding your baby, you might feel like, ooh, that's tight, like that after birth contraction pain. This is also why we do that fundal massage where we rub the top part of your uterus on your stomach. It's to help get your uterus to contract and shrink back down. We're trying to expel those blood clots. We're trying to get that uterus to contract. We want those blood vessels to contract so that we're reducing the risk of bleeding, reducing the risk of hemorrhage. This is why sometimes we might give you medications after delivery, like Pitocin, TXA. There's a variety of medications. If your bleeding is higher than we would like and your uterus isn't contracting, it might feel what we call boggy, where it's just kind of soft and squishy. We don't feel it contracting. We might give you those medications to help it contract, to keep you safe, to reduce that risk of hemorrhage.